All right, you guys, we're going to go ahead and get started. I am recording the meeting and it'll be posted later. Please do put your name in the chat so we'll have that for attendance. And I will get out of the way here. Let me share this. Do you have everything up?
Put on first. Put on person first. Both mothers. All right, can everybody hear me okay? Assuming that you can hear me, because I hate to be doing this by myself. Okay, very good. Thank you. So anyway, we're going to talk about an introduction to physiology and how, we'll get this out of the way here. Introduction to radiation effects on your body. All right, to start with, most of this information is available from the CDC on radiation emergencies to keep the public and first responders informed. So there's your source to go to if you ever have a question. Events that involve the release of radioactive materials can occur in several ways. These include accidents involving truck transporting radioactive materials to hospitals, unintentional release within the hospital, such as accidental drops of radioactive material, and incidents of industrial factories that use radiation in their manufacturing process. Additionally, releases can occur from nuclear reactors or as a result of a nuclear explosion. Unlike other sources of radiation, a nuclear explosion releases a wide variety of radioactive isotopes. But we don't have to worry about that. In the event of fallout or any release in the area, the key things to remember are get inside, and stay tuned to local authorities, just like you do for a tornado. And with that, FEMA, gracious us with the video. What? I did. Why? Oh, not good. Well, can you see the video? And it does have text on it. Well, anyway, you can't hear it. Key things in the video is get inside, and stay tuned. You can speak the sign language. You can also watch it. Okay, we'll go on to it. Contamination refers to material that remains on the surface, such as the ground, a table, a box containing the material, or even a person. Exposure pertains to being in proximity to a radioactive source and receiving a dose from it. Prevention is essential for minimizing risk, and the key strategies to remember include, just like we talked about, maintaining distance from the source, reducing the time spent near it, and placing some kind of barrier, such as a wall, a vehicle, or a building, between yourself and the source. Just this is a station identification, WKTP. Just as an interesting note, there's contamination on the ground. It's referred to as ground shine. So there's one for your vocabulary. If contamination is on your person, remove your outer clothing. Wash all exposed skin and hair with lukewarm water and soap, and avoid spreading the contamination as much as possible by placing your clothes in a bag. Are you everybody? Yeah. Is everybody able to hear me okay? Just let one person. Yes, I see some thumbs up. Okay. Just checking because it's kind of quiet on this end. All right, keep going. When assisting individuals in need, the top priority is to ensure they are medically stable. As a first responder, it is important to wear gloves. And in certain situations, you may also need to wear a gown, mask, face shield, shoe covers, just like we've practiced before. If these protective items are not available, providing medical care to the injured person should still take precedence. Always try to reassure the person that you are there to help, that more advanced care will arrive shortly. Staying calm in such a situation is crucial. Follow emergency instructions as provided. Always limit your time near any radiation source and increase your distance. Use shielding whenever possible. You notice there's a theme. You keep repeating the same stuff over and over. Time, distance, and shielding. So with that, if, like I said, if you want to look up and do further study on this subject, you can go to the CDC website, CDC Toolkits, Emergency Service, and look up radiation emergencies. Now let's get into a little minor physiology. Let's take a close look at the light spectrum of non-ionizing radiation. Remember, anything emitted from a single point source is considered radiation. Radiation is like your flashlight, it emits light. Your microwave that cooks food, your stove, all of that emits a type of radiation, non-ionized. So let's just take a quick look at the non-ionizing spectrum. The visible range for human is approximately 400 to 700 nanometers. Some animals can see slightly further into the infrared spectrum, while others can detect more of the ultraviolet range. Issues can arise from excessive exposure to any part of the light spectrum over an extended period of time. This is true for all types of radiation. For example, too much exposure to infrared radiation, which can refer to can lead to premature skin aging and some surface cellular damage. This is a picture of a close-up of what happens to the skin. It kind of, you notice it as wrinkles. Well, let's go further. There have been several articles that have been published on the effects of blue light and low-level ultraviolet light, which can cause stress to the skin and essentially lead to skin aging. And this is an article that was written on blue light. So if that's something you're interested in learning about, there's a lot of data out there on it. Ultraviolet light, which we always worry about, we wear our sunscreen, hopefully. Light causes beyond the visible spectrum can cause significant problems. UVC rays typically do not reach the ground and pose concerns to pilots flying at high altitudes. Water effectively filters out UVC light. UVA and UVB, just like you see on the suntan lotion, Rays penetrate the skin at different depths. While low levels of exposure are usually not a major issue, continuous or intense exposure, such as that which results in sunburn, can damage the skin and potentially increase the risk of skin cancer. It is important to note that all forms of radiation are non-ionizing. UVA makes up about 95% of the UV light and reaches the earth, and primarily responsible for skin damage. The breakdown of collagen is what causes the wrinkles and age spots. But we want to avoid that. And with that, here's an example. You may have seen this picture before. UVA rays can penetrate glass. This image shows a truck driver who, over time, was exposed to UVA rays while driving. You can notice the marked difference between one side of the face due to his exposure. That's from UVA rays. Well, let's talk about the next one, UVB. UVB rays have shorter wavelengths than UVA and penetrate the skin less deeply. They primarily cause sunburn and associated with age spots, including melanoma. However, UVB rays also play a crucial role in the production of vitamin D. So it's good to have some exposure, but not too much. You don't want sunburn. All right, moving on up the spectrum, now we're going to start to hit ionizing radiation. And the one that everybody's familiar with, X-rays, your favorite. After ultraviolet C, UVC, in the electromagnetic spectrum, we find X-rays. X-rays are a form of ionizing radiation that allow us to create images of tissues and structures inside the body. While they are a crucial imaging tool, X-rays can also carry certain risk and have the potential to cause changes in DNA. It is important to note that X-rays occur naturally at very low levels. All radiation occurs naturally at very low levels. But let's see what happens when radiation, ionizing radiation, hits the body. If you remember, the body is made up mostly of water. When ionizing radiation reacts with the body, it affects the water molecule, H2O, and makes up a significant portion of our bodies. The radiation can break these molecules apart, resulting in the formation of oxygen, hydrogen, and hydrogen peroxide. Hydrogen peroxide is a very harmful substance to the body. We measure radiation doses in sieverts, which indicate the amount present, and in grays, which present how much the body has absorbed. Now, we always think of the English side, the American side is REM, Roentgen. One sievert is 100 R, or 114 Rankine. For our purposes, the terms rad and rem are essentially equivalent. So we don't have to worry about any conversions. Gray and sievert are both units used to measure radiation exposure. The gray is the SI unit, European, for absorbed dose of ionizing radiation, which indicates the amount of energy deposited in material by the radiation. In contrast, the sievert, the SI unit for equivalent dose, taking into account the biological effects of different types of radiation on human tissue. Quick example is if you were to expose your foot versus your head is much more susceptible to damage. While the gray measures the physical impact of radiation, the sievert offers a more comprehensive assessment of potential harm to human health. The gray is the unit commonly used in medical imaging, radiation therapy, and industrial radiography to measure and monitor radiation doses. It helps healthcare providers ensure the patient receives the appropriate amount of radiation during treatment while minimizing the risk of side effects. In contrast, the sievert is used in radiation protection and occupational safety to establish dose limits for workers exposed to ionizing radiation. The sievert provides a more comprehensive assessment of radiation risk by considering both the absorbed dose and biological impact of health.
I have a comment in the chat.
Yes.
U.S. Nuclear Navy uses REM and more commonly MREM.
MREM is millirem. So it's still REM. It's just a 1/100th, like a milligram for a pill versus a gram for a pill. So it's just the metric system. So in review, 1 gray, I know it's an odd name, 1 gray equals to 1 joule of energy absorbed by per kilogram of matter. Okay, what that translates into, a joule is a watts per second. Okay, that's still way out there. Comparison, a defibrillator, when they shock somebody to bring their heart back, is 360 joules, just to give you an idea of the amount of energy we're talking about. Alpha particles have a higher quality factor of 20, making them more damaging to gamma rays. But here's the thing. Gamma rays will penetrate quite a long ways and cause a lot of damage. Alpha only goes about an inch. So why is alpha a problem? Think of gamma rays as more of a BB. Very fast BB, but a BB. And alpha is more like a baseball. When it hits you, even at a short distance, it can do damage from the inside. Generally not an issue on the outside. It's more of an inside contaminant. For gamma radiation, 1 gray equals 1 sievert. For alpha particles, 1 gray equals about 20 sieverts. Now, let's look at high levels of radiation. A large amount of acute radiation poisoning occurs from radiation received all at once. This comes in 4 phases. Primordial symptoms may include vomiting, nausea, diarrhea, and loss of appetite. You have probably seen that on TV. A few minutes to a few days later after exposure. The latent phase is a point you see be recovering from flu-like symptoms. So you had something looks like the flu, and now you're recovering. This may happen a few minutes, a few days to a week later. But then, a little later, you have the phase manifest illness. They all come back. And at this point, you're either going to recover or you're going to die. Put in perspective, if you were to have 125 abdominal x-rays all at once, you would reach the low limit of ARP. The most likely way to reach this level of ARP is to be exposed to a nuclear blast. That's something we don't want to try out. Radiation ranging from 1 to 10 gray or 100 to 1,000 rad can penetrate and damage blood cells, including both white and red blood cells. The damage prevents production of new white and red blood cells, leaving the body vulnerable to and unable to fight off infections. Greater than 10 gray, cells in the intestinal tract are destroyed, leading to death from nutrient absorption failure. Keep this in perspective. We set up our equipment and are trained to call in at 1 rad, 1 rem, 0.01 gray, very low levels. We're calling in, saying, hey, there's something out there. So working a site, generally you will never see any of this. Continuing on, a DNA molecule resembles a twisted ladder. The long sides of the ladder are composed of sugar phosphate molecules, which together form the backbone of the DNA structure. The rungs of the ladder are made up of pairs of 4 nucleotide bases: adenosine, guanine, cytosine, and thymine. I have a hard time pronouncing those 4: the A, the G, the C, and the T. That's what makes up our DNA. And when radiation hits one of those rungs, it can cause damage. Most of the time, the DNA can repair itself, but not always. Iodine radiation can interact directly with a DNA molecule. This prevents cells from reproducing. Direct action can also damage critical cellular systems. Sometimes can even lead to cancer, particularly with fast-growing cells like bone marrow. Alpha particles, beta particles, X-rays, gamma rays can directly affect a DNA molecule in 1 of 3 ways: changing the chemical structure of the bases, breaking the sugar phosphate backbone, or breaking the hydrogen bonds connecting the base pairs. Just in a reference, ionizing means that it's enough energy to knock off an electron. When you have a molecule that is stable and happy, and you knock off 1 electron off that molecule, it becomes ionized. Now it wants to combine with something and get back to its normal state. That's when you start getting problems. You have chemical changes in your body. Decontamination prevents radioactive material from spreading more. It also lowers the risk of internal contamination from inhalation, ingestion, and or open wounds. I can't say that. Treatment for damaged bone marrow. A protein called leucine colony stimulating factor, leucinites, promotes the growth of white blood cells, may counter the effects of sickness of bone marrow. Now, people talk about bone marrow transplants. They're only about 50% effective. Treatment for internal contamination, and I know you've seen this. Potassium iodide is a non-radioactive form of iodine. Iodine is essential for proper thyroid function. If you're exposed to significant radiation, your thyroid will absorb radioactive iodine, just as it does with other forms of iodine. Essentially, the radiodine is cleared from your body through the urine. So we are going to flood our thyroid with good iodine. So the bad iodine just gets washed away. Body doesn't need it. That's only if you're exposed to radioactive iodine. Prussian blue, radiogarlase, is a treatment that binds particles of radioactive elements, specifically cesium and thallium, by prescription only. The radioactive particles are then eliminated from the body through feces. The process accelerates the removal of radioactive particles and reduces the amount of radiation that cells may absorb. However, it does not eliminate other forms of radioactive material or prevent external exposure to radiation. Like I said, Prussian blue is only available by prescription. It's not the stuff that you can buy in the hobby store. And you can see in the picture how it binds to cesium and thallium. You notice there's a technique here. Each drug only works on 1 type of radiation material. Diethylene trimine pentacetic acid. It's a long word. This substance binds to metals, DTPA is the shortened form, binds to particles of radioactive elements such as plutonium, americium, and curium. But where are you going to run into these elements? In a nuclear blast. The radioactive particles pass out the body in the urine. This lowers the amount of radiation absorbed. With that in mind, I have found there's another experimental substance called TP508. It's used for the treatment of diabetes for severe cases. But they also have found that this drug has been found to help the treatment of intestinal cells and repair cells after a radiation exposure. It is still experimental. There's more treatments on the horizon. It's just not quite ready yet. And there was an article I read referencing treatments that if Chernobyl was to happen today, we have much better techniques and treatments to take care of people than they did back then. That was 30 plus years ago. If you have radiation sickness, you may receive additional medications or interventions to treat your problems, the symptoms, bacterial infections, headaches, fever, diarrhea, nausea, vomiting, dehydration, burns, ulcers, all symptoms. It's not necessarily going to fix the radiation issue. So in conclusion, the likelihood of being exposed to high levels of radiation is extremely rare. A nuclear explosion is the most probable scenario for such an exposure. In the case of standard nuclear accident, the radiation levels that the general public could experience are very low. FEMA and the state authorities have established guidelines to help prevent any exposure, even at minimal levels. It is important to focus on decontamination and wear personal protective equipment as instructed. Are there any questions on this? I put everybody to sleep. Samantha, I think this next slide is yours.
No, it's yours.
Just so you know.
Thank you.
Just so you know, Samantha has gotten a new job with Wake County doing very similar work with training and exercise. And Sean Kanoy will be taking over as Revc program manager starting February 2nd. I will still be here and Samantha will still be available indirectly, but hope you have enjoyed this and look forward to the next one. Matt, anything you want to add? She says anything she didn't want to add. Any questions on anything? What's up?
I think that,
Oh. I'm going to go down there.
that's okay. I saw all of them.
Okay. U.S. Nuclear, yep, we saw that one. Yep. We'll miss you, Samantha. Yes, I'll miss her too.
I'm not leaving you.
Oh, okay. Just checking.
No, I will not still lead Rev C. That will be Sean Kanoy. He will be taking over as of February 2nd. I will not be over CERT. No, Sean will be doing that as well. So I'm moving on to newer things. But you know, the CERT program in North Carolina and the Rev C program, I feel like they're both really strong. And you guys, I'm going to count on you to keep both of them running and keep doing wonderful things. And I'll be watching from not very far away.
Yep, thank you.
And yes, the slides, I don't know if, I guess it's up to Jay if the slides will be available in an email, but this meeting has been recorded and now will be shared on YouTube. Yes, so yes, I am still the president of the National CERT Association, but that's a volunteer position, so that doesn't pay as well. I'm actually going to work for Wake County Emergency Management. So I'll still be right here local. I see that. Melanie, I see your note. So yes, Sean is not on this call right now. He has been at several of our trainings. Once, I love you too, Melanie. He has been online at many of our trainings, and he has been a lot of in person at a lot of the Revc trainings. So we'll make sure that you guys get to meet him. I guess I forgot to look at when the next Revc meeting is. I want to say April-ish, because it's about every 3 months. And so you'll see Sean then. And you never know, I might oh, thank you, Stan. Our next Revc meeting is April 13th. So Sean will be leading that. We already have things planned. We have a whole schedule for the year, also for the NC Cert webinars. Those are planned out through 2026. So really nothing's changing. It's all going to be just the same. And you guys will keep it all going.
Samantha, this is Tony. I just want to tell you, I've known you quite a few years, and CERT would not be anything without you taking over the CERT program and progressing it where it is now. It's just amazing what you've done for CERT.
Thank you, Tony. I appreciate that very much. I'm counting on y'all to keep it going. And like I said, I am still involved at the national level and the local level. I'm still involved with Apex CERT, and I'm the president of the National CERT Association. So I'll still have my finger in the pie, but it'll just be a little different. But thank you for saying that, Tony. I really appreciate it. Thank you, Andrew. Love you guys. All right. Like I said, there will be a recording available of this. Probably be tomorrow or the next day that I will get it up on YouTube, and I will send that link out to all Revc volunteers. So if you know anybody who couldn't make it tonight, they will be getting that link for the recording as well. But thank you all for coming, and we'll look forward to seeing you around. Thanks, y'all.
Bye.